Does this mean that if we're socially isolated, we're doomed? There's nothing to do about it? Certainly not. There are many effective interventions for treating social isolation. During COVID, I have noticed loneliness and social isolation to be in epidemic proportions in the patients I see. And the interventions I'm about to present have been effective for treating social isolation and loneliness in my patient population and are well validated in the literature. Let's take a closer look. There are 4 proven strategies in the research for addressing social isolation: enhancing social skills, providing social support, that's number 2, increasing opportunities for social interaction, and addressing maladaptive social cognition. The last one, addressing maladaptive social cognition, is far and away the most effective intervention. Enhancing social skills and the other 2 are less effective. Enhancing social skills is rarely helpful. Providing social support means studies are conducted where people are scheduled, where a nurse or someone in the study actually goes and visits the socially isolated person. So it's kind of artificial. It's hard to reproduce in real life. I will focus, though, on the increasing opportunities for social interaction because COVID and shelter in place has made it much more difficult to interact with others. I will say that I screen everybody in my practice who comes in for social isolation and loneliness, and I always ask the people who are not reporting social isolation and loneliness how they do it. And so these are some of the tips that I've gleaned, as well as tips from the research. Connecting online around common interests is one effective strategy. So if you play tennis and you look online for a tennis partner, tennis is a great way of engaging in a sport, even and maintaining social distancing. If you're interested in a romantic partner, dating apps are available, and many of them now are offering video dates, which has become very popular. Many of the patients I see who had regular in-person interactions with friends and family now schedule Zoom calls or meetups online with their friends and family and scheduled. I think that a good approach to this, especially if you're new to it, is to determine ahead of time, I'm going to just spend 15 minutes a day on looking for people with common interests in my area. Or I'm going to spend 1 hour a week on a Zoom call with friends and family. But the point is that, especially if you're getting started, it can be difficult at first to find people or to make these connections feel natural. And if you commit in advance to a certain amount of time, and you'll be able to weather any initial setbacks, and you'll have it as a habit you've integrated, and it will bear fruit over time as you keep trying to find others and keep connecting with others online. But I want to spend more time now on addressing maladaptive social cognition because it is the most effective strategy for addressing social isolation. This won't necessarily apply to you if before COVID you were completely socially connected or you just moved to where you're currently living, and before you moved you were completely socially connected. Addressing maladaptive social cognition is more for people who have a persistent social isolation in their past, and they can't kind of chalk it up to a recent change in their environment. So addressing maladaptive social cognition is done in the hands of a skilled cognitive behavioral therapist. The underlying assumption with this approach is that the problem for someone who is socially isolated is negative beliefs and predictions about what social interactions will be like, rather than just not having enough opportunities to interact with others or lacking the social skills to interact with others. So in line with the theory that we already outlined of why people become socially isolated, because they had an initial slight that caused them to have persistent negative beliefs about others, this approach aims to challenge those negative beliefs and predictions. And what happens is you talk to your therapist and you go over the before, during, and after of typical interactions you have during the day. And what you're looking for is to identify automatic negative beliefs and predictions. So if you are going into a meeting with your boss and you assume your boss is going to shoot you down, or you are going on a date and you assume the person on the date is going to think you're a weirdo, or you think the person on the date is not going to like you, you start to catalog and identify, wow, these are my automatic negative thoughts about interacting with others. These are the predictions I have about what's going to happen when I interact with someone. So you first then identify those beliefs and then you test them. So if someone with negative beliefs has inevitably closed off opportunity to interact, because if they predict something bad's going to happen every time they try to reach out to someone, they're going to stop reaching out to someone. So in cognitive behavioral therapy, you'll do these little life experiments where you will test out that negative prediction. You identify that anytime I ask someone out, I get rejected. So that's my negative belief. So I've stopped asking people out. In cognitive behavioral therapy, you'll actually say, okay, that's my prediction, but let me revisit that prediction and test out with a couple more examples if in fact every time I ask someone out, they reject me. So I'm going to ask 5 people out over the next 5 days. And what that does inevitably is disconfirm those negative beliefs, those negative predictions. Maybe one person says yes. And what that does is it allows you to hold up to the light your negative predictions and disconfirm them with actual real life experience. What this does overall is start to dismantle those negative beliefs and negative predictions, and overall gives a person an enhanced sense of personal control. If you're laboring under the assumption that the reason you're socially isolated is because people just don't like you or wouldn't want to be in your company, if you replace that with an understanding that you're actually not in social interactions because of your beliefs about other people, it makes this problem in your control to solve. You can then revisit your thoughts about other people. Whereas if it were just the case that nobody likes you, that's not something you can do much about. Cognitive behavioral therapy, therefore, is an effective strategy for challenging your own beliefs about interactions with others and replacing them with more positive and accurate beliefs about the world. To find a cognitive behavioral therapist, I recommend you check out your health insurance website. And you can also look at this link where I post reviews from patients of therapists that they are currently seeing. Most of these therapists are based in San Francisco, but most of them are also doing telehealth visits, so you can avail yourself of their services even if you don't live in the area.